Up next are presentations on the role of pulses in nutrition security. The speakers are Dr. Roshani Sanghani, founder, Aasaan Health Solutions, and Ms. Becky Garrison, Director of Domestic Marketing, USA Dry Pea and Lentil Council and American Pulse Association. We now invite Dr. Roshni Sanghani is an American board-certified endocrinologist and founder of Aasaan Health Solutions, which helps people build healthy lifestyle habits to reverse PCOS, obesity, type 2 diabetes, and hormone imbalance with the least amount of medication. She is a certified personal trainer from the American College of Sports Medicine, certified mindful eating facilitator, certified diabetes educator by the American Association of Diabetes Educators, and behavior change specialist. Dr. Roshni Sanghani.
Thank you so much for having me here, Mr. Pradeep and Mr. Bimal. I should specifically thank you for that. Is it okay if I share my screen?
Yes, ma'am. Please go ahead.
Okay. Okay, so I want to specifically talk to your audience today, such a fascinating spread of attendees and panel about pulses and the role in our daily diet. And again, an endocrinologist is something maybe you know or you don't know what that even means. Is I'm a hormone specialist. So I'm a medical doctor. After MBBS, I finished my MD medicine, internal medicine, and then this was in the US. I did my MBBS in Bombay and then my MD medicine in the US in Chicago. And then I did my super specialization or fellowship in endocrinology, which is all the hormones, diabetes, insulin, all the hormone imbalance, weight, metabolism. So I'm a super specialist when it comes to any hormone imbalance. And today I want to talk to you about how to change things in your nutrition that can help your hormone balance from a clinical perspective. So hopefully with the FAQs, the questions that have come up in our practice in our clinic, I can share that with you today and clear some misunderstandings about pulses. So first of all, being in endocrinology, diabetes becomes a very big part of what we work on. And this is the most recent updated document by the American Diabetes Association. It's a brand new document, 2021. Okay, it comes out every January. So it's really fresh information. And in there, it's very clearly written that if you focus on whole grains, legumes, nuts, fruits, and vegetables with minimally refined or processed food, this is definitely associated with a lower risk of type 2 diabetes. And I would say that 2020 in our practice was a big wake up call for many people because of the pandemic, because we heard so much about how diabetes, obesity, hypertension, these things were causing worse outcomes or correlating with worse outcomes in COVID. So I gave a lot of talks in 2020 about what can you do on the lifestyle end to even hopefully reduce your risks of having a bad case of COVID. But this is to talk about proven documentation for type 2 diabetes that legumes are in the mentioned piece of advice for type 2 diabetes management. So how does this translate to something in my practice? This is a slide I show to all my patients, which is to, if you are focusing your plate on carbohydrates, which is your chapati, your roti. We in India, we love to fill our plate with roti and rice as the grains, because I think today the audience is grains and pulses, right? Pulses and grains. So we have a habit of filling up a lot of whole grains in our diet, and I'll come to whole grains in a few slides. But if you are eating 4 chapatis and 1 cup of dal and 1 cup of vegetables, what we ask our patients to do, and this is something that I learned from a real patient. This gentleman actually came to me with uncontrolled diabetes, and the blood sugar was 240 with this type of a food plan. And he was already on 5 tablets for diabetes, and he was sent to the specialist endocrinologist, which was me, to get him started on insulin therapy. And he really flat out refused. He said, I will not take insulin. Tell me what I can do in my diet. And I remembered my diabetes education as being a diabetes educator, that let's reduce the carbohydrates. So the roti being higher in carbohydrates, we asked him if he was willing to cut the carbohydrates through roti and increase the rest of his food. So we asked him to literally double his portion of the pulses, the dal. And with this very simple change, his blood sugar came from 240 down to below 100. It came to 94. And he was so shocked that he came immediately back to the clinic and he said, Doc, can you please reduce my 5 tablets? I want to go to 1 chapati. I'm happy with my dal and my sabji. And this was a very big wake up call for me, because as doctors, we are completely programmed and trained to think that patients don't change their lifestyle. This is something doctors are brainwashed to believe, which is clearly not the case anymore. And second thing we're trained to believe is that as doctors, that once the patient fails on 5 tablets, you need to move to insulin injections. But I think today we should talk about how if you reduce your pure carbohydrates and increase your pulses in your diet, there's a good chance your blood sugars can start to come down. So this is what Rajma Chawal looks like in my house. That's kidney beans and rice. And normally in India, if you see somebody taking dal chawal or dal and rice, they would fill the bowl first with the rice, and then the gravy beans go on top. The dal goes on top of a bed of rice or a bowl full of rice. That's not how it works in my house. A bowl of Rajma first, filled up, and then rice goes on top as a garnish, the way you would put the coriander, cilantro, or dhania, as we call it. The garnish is the rice, so that I get a mental satisfaction that I had dal rice or rajma rice. Okay, and this on this particular day, this is a real picture from my dining table, and that day I had some seeds in my house, so I just threw some seeds in there for some crunch. But again, the changing the ratio or the relationship of what is a normal portion of dal and rice was a very big thing to learn from my patient. If I ask the audience, I think today you have a very big audience about, do you struggle with food addiction, and how we, at the end of the meal, the menu for dessert comes, and there's always room for dessert at the end of a big meal. They never bring you the dal menu at the end of the dinner, right? Because there's never room for dal or pulses at the end of the meal. Why is that? Because protein that comes from pulses is actually very filling. And there's a reason why certain foods are very addictive. This is a cartoon, okay? And these blue arrows in the brain, in the human brain, these are just cartoon representation that the normal hormonal pathway, again, I'm a hormone doctor, there is a normal hormone pathway that is followed by things like vegetables, pulses, okay, which would signal the hormones to the brain, I am full. I am full, I am not hungry anymore, you can stop eating. But the foods which we find addictive will not follow this normal hormone track, and they will go in the addictive hormone track where there is dopamine release. So if you have someone addicted to cocaine, it's the same pathway in the brain that's triggered by feeling addicted to sugar. It is the reward pathway, it's the addiction pathway. Nobody tells me they're addicted to dal, okay? And so today, that's something we have to convert that to our advantage, is to understand that restoring the natural forms of proteins through healthy protein sources, natural whole pulses, helps you feel the fullness which is naturally there through your hormones. And why are you addicted to junk food or fast food? Again, coming to the hormonal explanation, these are formula created with multi-million-dollar secrets behind them. How do you make an addictive recipe of carbs plus fat plus sugar, salt, caffeine, all these combinations of all the foods that you can think of in your mind, which you might struggle with? They're easy to pick up and eat with your fingers, easy to eat while you're multitasking. Most of us cannot really eat a bowl of dal in the middle of a movie. It's not something that matches if you think about it, right? You don't, it doesn't work the way junk food works. Somebody might be worried in India, especially, I don't know why this myth kind of still exists in India, but it's a very common myth. We get it almost every day, is if I eat too much dal, I'll get a uric acid or a gout problem, or they experienced gout and or high uric acid on the blood test. And so somebody from the health world, health profession, told them to stop dal or reduce dal. Now that's a terrible, terrible mistake. So this is a website from Mayo Clinic, mayoclinic.org, where they talk about what's allowed, what's not allowed in a gout diet. Okay, and they talk about what gout is. This is 2021. I looked again, I keep checking their website to see if they keep changing it, but they don't. Weight loss is very important if you want to reduce your risks of gout. Focus on complex carbs, which is whole fruits, whole vegetables, whole grains. I will come to you about whole grains. Complex carbohydrates. Avoid high fructose corn syrup or processed sugar or sweeteners in the food industry. These things are rampant. There are almost 67 names for hidden sugars. So it's actually sugars and simple carbohydrates that you need to avoid for gout and uric acid, not dals and pulses. Limit consumption of natural sweet fruit juice. In India, we love our fruit. We love to make juice. And this actually gives you a huge glucose spike. It gives you a huge insulin spike. Again, I'm an insulin specialist. And high insulin, high glucose, high sugar directly gives you uric acid problems. Okay, so it's not the dals and the pulses. It never was. In fact, this is the same Mayo Clinic webpage where it says proteins, focus on lean meat if you eat non-vegetarian food, poultry, and lentils, which is pulses and legumes, as a source of protein. Now, I struck this out myself. That's my initials, low-fat dairy, because I personally am not in agreement with this, the take that they have on saturated fat. But I'm not going to get into that chaos today. That's a completely controversial subject. We can have another talk one day. Look at this. High purine vegetables such as asparagus and spinach do not increase the risk of gout. So I see so many people being told to reduce vegetables, to reduce dals. So if you tell someone who's vegetarian, reduce pulses, reduce dals, reduce vegetables, what are they going to eat? Carbohydrates. And then the uric acid actually does not come down, and they are then getting prescribed uric acid lowering medication. Okay. And my goal is to help you have the best health possible with the least amount of medication. Alcohol raises uric acid. Again, sugary foods, sugary beverages, processed grains, natural sweet fruit juice. That's natural juice. Even with no sugar added, you have sugar in fruit. So fruit juices can push your uric acid levels up. What about whole grain? This is my gripe with the word whole grain. Now, whole grain, the word has been abused, okay? And in India, these are the tricks and traps when it comes to whole grain. This is a box of so-called whole grain cereal, which if you look at the way they've done the packaging, they've said the word whole grain in 3 places on the box. All right, but this is something which you can directly eat it without cooking. It does not take cooking. You can just pour some milk if you want, but you could directly eat it like that. How about idli, poha, kurmura? These are processed forms of rice. They don't look anything like a whole rice grain. You cannot put a whole rice grain in your mouth and eat it. You need to process it. Same with wheat. Whole wheat is different from upma, shira, dalia. Okay. Whole lotus seed, if you Google the image of a whole lotus seed, you will not consider it is an edible thing. It goes through a lot of processing before we make it into these snacky makhanas. So it's not whole grain lotus seed anymore when you buy it in your snack shop. Same thing with millets. Whole ragi millet is very different than ragi biscuits and ragi khakra. So the word whole grain means once upon a time it was a whole grain. We will process it 20 different layers down to a fine powder, put it in a box, put a label on it that says whole grain, and you'll think you're eating a whole grain. It used to be whole grain, it's not anymore, okay? And this is fantastic. I magnified this because here it says, look at the bottom. It says 100% of the grain is whole grain. I mean, you really get convinced, don't you? 100% of the grain is whole grain. It used to be a whole grain. Okay, so on the back of the same box, I really got very curious. I started to become an investigator. This is the box at the back. It says whole grains, and they say they have whole grain brown rice in there, and there's a picture of brown rice on the front of the box. But when you pour the box into your bowl, you don't get whole rice out. You get brown rice flakes, which just dissolve in your mouth or dissolve in milk. It says whole grain jawar on the front, and on the back it says jawar flakes. And whole grain jawar is something edible to this goat friend of ours, not us. You and I don't go around eating whole grain jawar without processing and cooking it. Rolled oats, it's not whole grain oats in the box when you pour the box. These are all the different ways that oats can be processed. At the top, you see whole grain oats, and these are all the different ways you can cut the oat grain, the whole grain, into multiple different shapes and sizes. And the more you cut it fine and small, the less cooking time it takes. So instant and whole grain do not go together. It's not possible. Okay. Protein. People ask me, is this a high protein diet you're putting me on? And in India, we are very phobic of protein. I don't know why. Okay, we are trying to get you to a minimum of zero point 0.8 to 1 gram per kg reference body weight. So if you're a 60 kilogram person, we're looking for at least 48 to 60 grams of protein a day. Some of the Western targets, we may feel concerned as Indians that can we take so much protein? It's a bit debatable whether this is considered a high protein diet, but we agree that high would be closer to 1.5 to 2 grams per kg body weight, would be on the higher side. I'm just saying, if you look at the Indian diet, when somebody's been scared about dals, when they don't eat much vegetables, when the masala, when the spice is so high that they need to dilute the spice with roti and rice and carbohydrates and breads, the amount of protein an average Indian gets in my practice, when I talk to them and we do the calculations of their nutrition, we find they're taking 0.2 to zero point 0.3 grams per kg per weight. They're hardly getting about 15 to 20 grams of protein per day instead of 48 to 60. So they're getting about 1/3 of their required, or 1/4 of the required protein. So we are saying, don't sit at 1/3 of what you need. Let's get you to your target for the day. Let's get you to a normal, sufficient protein. There's no disagreement about at least getting people to 0.8. Okay. So that's not high protein. It's just higher than where you were. Yeah. High would be going all the way. We're not asking you to go all the way. And maybe when you look at Western documents, when you talk to the Western health professionals, they will say a low protein diet is 0.8. It's amazing, depends on which country you're talking from, what is high and what is low. So we're separated by two oceans, looking east and looking west. What is high and what is low? Let's look at it mathematically, because in the West, low protein is 0.8 and Indians are getting worried is 0.8 too high. Okay. It's amazing. So what we suggest to our clients is focus on plant-based proteins. If you eat non-vegetarian, that's fine. But today's a pulses talk, so I'm only showing you about pulses. Is what do you look for? Maybe look for 15 to 20 grams of plant-based protein per meal. Okay. And it's like, these are different ways. You could do some sprouts. You could do a sort of a sauteed tofu scramble, which is soya bean. Okay. What we call in India, soya paneer. You can do chilas, you can do chaat, you can do like a soya paneer vegetable. All right, there are different ways. One other thing we came up with we looked up on the internet was we took these chilas, moong chilas, stuffed it with vegetables, and then put another layer of chila batter on top and flip it. So it becomes like a stuffed chila. It's pretty filling, okay? When you make it with some healthy cooking oils, this can be very, very filling. Now, if somebody tells you that, well, I get too much gas when I eat pulses, right? The way we respond to that is, of course, if you take a new amount of pulses, beans, legumes, lentils, it's new to your digestive system. Not only is the protein molecule new, but the carbohydrates are new. There are natural sugars in pulses. Actually, per 100 gram of edible pulse, about 65% is still carbohydrate. All right. And if you look at maybe soybean, it's less, it's about 20% carbohydrate, but there is still a decent amount of carbohydrate in pulses. All right. That's why I showed you my Rajma Chawal. I go more on the Rajma because there is carbohydrate in the Rajma, and then I just go like that with the rice. But there is natural sugar and carbohydrate in the pulses, which will start to cause a change in fermentation in the gut and the gases that form with the new bacterial population. More fiber, again, that can cause some gas formation in the first 2 weeks. But, when governments change, I think globally we know that recently we've seen that when governments are trying to change, it can create a lot of tension. And so government change is not easy. So when the gut bacterial population has to move away and a new population has to come into power, which is the healthy bacteria, you may have a transition period of gas and bloating and distension. So the idea is to do it in small steps. We don't say if you're at 20 grams of protein today, go for 60 grams of protein tomorrow. You may end up having some gas issues. So you can go up gradually. Your body will adapt. Your body is intelligent. Okay. People are worried about phytates and lectins. Again, phytates do occur in legumes. And it is in theory talked about that it can reduce the absorption of micronutrients. The way Indian wisdom and traditional culture from our grandmother's time and home wisdom was to remove these nutrition blocking agents by soaking the pulses, by sprouting the pulses, boiling the pulses before you eat it. None of us go around eating raw pulses. We do a lot of things to the pulses before we eat it. And they've even done studies on vegetarians whose nutrition is high in these foods, plant-based proteins, which have phytates, and they've not found the deficiencies of iron and zinc that were expected. So probably a body, the human body, when it is constantly exposed to these nutrients, it understands how to increase the absorption of iron and zinc because of gut intelligence. Okay, so this is a really useful thing to know so you're not scared. I think I'll leave you there with some contact information, and I'm sure we can take questions after we hear from Becky.